It's Dr. Cassie Smith, and welcome to Back to the Basics, a simple approach to health in the modern world. I appreciate you taking the time to join me today and hopefully learn ways that could help you improve your health. The modern world has left little time to focus on health and wellness. I hope to give you some quick and simple ways to be well and live your best life. Welcome back to this week's episode of Back to the Basics. I'm glad that you joined us this week to learn more about how to keep yourself healthy in this modern world. I have a very exciting guest today. A lot of you have actually reached out to me and asked me to put him on the podcast. So he finally agreed. So Dr. Cory Rice is here. I met him through BioT. He's an amazing practitioner in Dallas. He graduated from Baylor University with a bachelor's degree in forensic science. And then he completed medical school at Arizona College of Osteopathic Medicine. He attended Methodist Medical Center in Dallas for his internship and residency in internal medicine. He was chosen as chief resident. He spent 2 years in outpatient traditional internal medicine, including inpatient work and critical care and hospitalist medicine, before he and his medical partner opened a private practice after identifying a profound need for a more direct focus on preventative and wellness in the outpatient medicine setting. He now puts food first in virtually all of his medical recommendations and has continued to be amazed at the power of nutrition as it relates to improving function in the body and ultimately restoring health to his patients, which oftentimes leads to less prescription medicines. So he also has been trained by A4M. So a lot of you guys listening to this, you know about A4M and the Functional Medicine Institute, so IFM. And so he, like I said, is practicing in Dallas. He has a couple of clinics. We'll link all of his stuff in the show notes, but he is a specialist in bioidentical hormone replacement therapy for men and women. So again, that's where I met him. He's been doing this for a long time. So please help me welcome Dr. Rice to Back to the Basics.
Thanks, Cassie. Appreciate it. Glad to be here.
Yeah. So I like to start by kind of telling people or having you tell people what it's like to be you, like kind of how you got here. And so our stories are very similar, right? So I did traditional medicine kind of until I met you. That's what I told everyone. You know, I went to BioT training in 2020 and I was kind of interested in this functional medicine world. And then I met you and I was fascinated. I started doing BioT. And people know this that listen to my podcast. You helped me get better in 2022, I think, 21, 22. And I felt a lot better. And so I tell a lot of people it's your fault that I do functional medicine and that I'm kind of where I am today. But tell everyone kind of, I guess, how you got started in this process and then what it's like to live in the life of you for a day.
Yeah, sure. And first off, thank you. You have been a lifesaver to a lot of my patients, so I appreciate all the help that you give me and my patients. So, you know, I'm just a very small part of this. You're very sweet to say what you have, but the work you put in to get to where you are is absolutely inspirational. So any small part I played in that, obviously I take pride in that, but you did the heavy lifting. I did not. I truly feel I just showed you a little bit of a path, but you have to walk it. You have to breathe it. You have to eat it. You have to be it. So and this is sort of what I tell patients all the time. So you're the captain of your ship. I just try to steer it in a way that I feel like is medically safe and is going to give you the biggest return on your health investment. So that's really, again, what I think you did, but you're very kind to say that. So, you know, my background, ironically, is really not, I didn't really necessarily have an aspiration to go into healthcare. As you mentioned in my bio, I was actually the first graduate with the degree in forensic science from Baylor, and I didn't know what that meant at the time, but ultimately that degree also fulfilled all the pre-medical requisites to be able to sit and take the medical school entrance exams. But I didn't want to do that. I actually taught for the university for a little bit and worked partially in law enforcement, and really what my responsibility was to take skeletal remains in the ground, truly bones. So there's a movie out there called The Bone Collector. I was sort of like that. I taught human osteology for the university, and that really is just taking any bone of the human body and basically trying to approximate age, ethnicity, if possible, manner of death, and these types of things. From a forensics perspective, I looked at osteology and just tried to put a puzzle together. And that's what I did for 3 years before I decided to leave it because it's a very morbid world, right? So I realized that's just not where I wanted to go. Actually got into the FBI, turned it down, went into medical school, and just to kind of fast forward big time to where we are now, I'm truly doing now what I was doing then. Every human being, and you would know this just like I would, every patient is literally a forensic analysis. Everybody has their own story. Everybody has their own journey. Everybody has their own collection of things they've experiences they've lived, and things they've opportunistic things they've acquired and they've been around. And so understanding that story takes time. And so you use the term functional medicine. Functional medicine is really a way of practicing that just takes dysfunction and tries to put function back in place. And so that's truly what I try to do, is take someone who's dysfunctional, someone who has issues, whether that's losing weight, autoimmune disease, chronic pain, chronic fatigue, any of these sort of names we give things. I just sort of take those disease processes and forensically analyze what's happening to them, and then ultimately try to restore function. And that's done with all sorts of things. You've mentioned hormones. Hormones have been a big part of what I do. In addition to food, there's no question. We are what we eat. The reality, as you would understand, is the soil that we make our food from, unfortunately, today is just sick. And so oftentimes the food from the soil is sick, which means the people eating it get sick. So really things have gone beyond just food now. We're now in the world of pollution clearing from our body. How do we consistently clear ourselves of things that we just can't help expose ourselves to, no matter how well we eat? And so you understand that, I know, intimately well. And so there's just a lot of those things that go into restoring health to a phenotype or to a patient. And that's really the day to day that I do, and the team that supports me and that I support does as well, is we just try to give people the why behind what they have and get them back to their life. And that's ultimately what I do professionally, day to day. So.
Yeah. So a lot like what we do at Modern Endocrine, try to figure out, what are their ailments? How do we make them better? Give them simple steps, send them in the right direction, and you're kind of their coach.
Yeah,
And so like you
100%.
and I were talking about before the podcast, when you talk about environmental toxins, so one of the things we implemented recently at Modern Endocrine is ozone therapy with our thyroid management and gut and hormones. And it's been life changing to a lot of people because it does help with that detoxification process. And so I'm
Yeah.
hoping that you'll think more about that. Your patients in Dallas would love it, I'm sure. But
Well, things you recommend and things you touch turn to gold. So I'm gonna definitely take that to heart, and I think my patients could certainly use it. The irony is I've got quite a few physicians that are my patients, and I've actually helped um, you know, prescribe some of the things you need to have your own ozone and do it at home for some of my physician clients. They didn't want to self-prescribe, so I've helped them. And so they do a lot of their own treatments, and I guess they've been self-trained. They don't do it professionally for patients, but they do it personally. And so I've always thought about integrating it for my patients just because of what they say. And so you really are the cherry on top for me to consider that. So
yeah, because at the end of the day, like you said, it's all about like detoxification, right? Like you're going to get toxins in. How do we process and get those toxins out? How do we limit the toxins that come in so that our body can do the function that it needs, right? So you say functional medicine, like you said, I mean, endocrinology gave me a good broad understanding of like how the body works, right? In general, all your hormones, how they play together. But really it's also about like how do we give our body nutrition? And then how can our body take that nutrition, process it, use all of that nutrition, use the energy that it needs to make our body function, and then how can we get rid of toxins? That's really it. Like we are very fascinating humans, but I mean, you can break it down very simply, right? Like we need good nutrition, we need to detoxify, we need energy. And the crazy thing, like you taught me this. This is I remember this very vividly. You said, your microbiome, your GI tract regenerates itself every 30 days. And so no matter what you eat, I think you said like what you told me was, if you eat McDonald's and just complete garbage your whole life, and then you decide today, I'm going to change and I'm going to change what I eat. You are what you eat. And so your GI tract will completely regenerate itself in about 30 days and you can be a completely different person. And I remember sitting there when you did that lecture thinking, yeah, I've done a lot of really bad things to myself and I don't feel well and I don't, but like 30 days, like you can do anything for 30 days, right? And so
You,
I think that's where you and I, like, we can make a lot of impact in people's lives. It's just helping educate them and then help them realize that, like, no matter what you've done to yourself, like, we can fix it. And the great thing about your body is that it regenerates itself, right?
it
And
absolutely does. And you're
so
so spot on. And as your audience likely knows, with as much as you've podcasted probably on this topic, but if 70 to 80% of our immune system is inside of our gut, so many of us have immune systems that are not working for us, they're working against us. And whether you know it or not, I would argue a lot of people don't realize that it's actually happening because they don't really know what the signs and the triggers are. But you made a very poignant statement that, you know, yes, it does regenerate. The other part to this, though, when we take antibiotics, so antibiotics, right, they're not smart. They don't know if they're treating your ear infection, nose infection, foot infection. They just go nuke whatever, and then essentially just nuke all what's called the commensal bacteria of your gut. So the healthy immune supportive bacteria. What's ironic is if you look at the studies on this, so when people take antibiotics, it completely control and alt deletes their gut, wipes everything out. When they're done with their antibiotics, if they were to start eating nutrient dense food, really, really healthy food right after completing that last antibiotic, their microbiome would flourish and they would have a huge diversity of the flora, which then starts building their immune system back. But the reality is, when someone comes off an antibiotic, they're usually coming off something in which they felt bad. Well, so they probably weren't eating a whole lot. So really the natural human tendency is when I'm done with my antibiotic, I feel like I'm free and clear. I'm out of prison. You go eat what sounds good. And what sounds good is whatever, I want to go eat that pizza. I want to go eat that fast food. I want to go. And so once you do that, it just creates this whole cycle again where you just don't have an immune system that's working well. So the studies are pretty cool on that when you can actually eat healthy after carpet bombing with an antibiotic your gut and your flora, and then it just flourishes when you eat really well afterwards. So that's just a real life example I see all the time.
yeah, or just at any point. Like if you're listening to this podcast and you're like, man, I've eaten terrible. I'm gonna change. Like if you really say, okay, today's the last day for the next 30 days, I'm gonna eat a variety of food. I'm gonna eat the color of the rainbow. You guys know on this podcast, if you listen, I talk about 30 foods. Do you know you're supposed to eat 30 different foods every day? Most people don't eat 30 different foods in a week. But if you eat 30 different foods every day, then it changes your microbiome a ton. And so I tell people that's my goal every day is to eat 30 different foods. I might eat the same 30 ones quite a bit, but like I try to eat, my husband was just making fun of me before we did this podcast because I made a salad downstairs with like all the things in it, just everything that was in my fridge because I'd only eaten 12 different foods today. So I was trying to get my like other 18 in. But I mean, your body, like what I've learned over the last 4 years in this functional medicine space is that your body is really cool. It can regenerate itself no matter how sick you are, no matter how much you've damaged it. It is meant and made to fix itself. You just have to
100%.
give it the right things, right?
100%.
And
Yep.
and so I wanted to talk to you specifically. You're so smart. I mean, we could talk about hormones, we could talk about gut, but I want to talk to you about hormones today, just to kind of talk about how hormones play a role in your health, right? So how they play, I mean, they play a role in your gut too, but how they play a role in your health and maybe how people might know they're having hormone issues. And then we can talk about, well, some of the misconceptions with hormones maybe, and some of the different types of hormone treatment.
Yeah, sure. So hormones are, a part of everybody's health from birth until death. Hormones you know, have all sorts of medical, protective sort of roles, but then also lots of quality of life, sort of, you know, help as well. And so what I would say first and foremost is the Goldilocks principle for sure applies here. Too little isn't great, too much isn't great. There's sort of this sweet spot. And one thing I don't like to do in healthcare, and you may be similar to me, is I don't like to make broad brush statements about categories because everything we do, the more the kind of medicine we practice, the more we realize just how individual and different everyone's response is to anything. And in this particular category, it is absolutely true. Hormones, a female and a male have a sweet spot of what makes sense for them from a hormonal perspective. And the reality is that sweet spot moves. It's not a stationary endpoint. So you have to be very adept as you are to talking to patients and sort of understanding where they are on their hormone sort of trajectory. And so what I would say is done the right way. If you can balance a female's or a male's hormones appropriately, it gives them maximal return. And the sweet spot, I would tell you, is defined as that, the maximum return in whatever you're looking to do. So medical prevention, symptom relief or alleviation, while minimizing any of the negatives that can come from this. And really the negatives are what we would call secondary. So just things annoyances that you don't want to deal with by having excess hormones. And the reality is, females lose hormones starting in their early 20s, and then it accelerates into their 30s. Certainly by their late 30s into their early 40s, their hormone levels are just plummeting. And so it's something we have to be very keenly aware of, and not just wait for, menopause and sort of these later stages of life. It's all about early detection and early diagnosis. Same thing on the male side. They just sort of hit that. It's probably a little more in the early to mid 30s, depending on the male, when their natural production of their hormones start to decline. And so all of this is a very natural process, but depending on someone's health status, it can become somewhat unnatural, at least when they start losing the hormones, but when they become symptomatic, I guess, from losing their sex hormones. And so these are things I'm sure you've talked about, but on the female side, there's essentially three sex hormones: estrogen, testosterone, progesterone. On the male side, there's testosterone. Yes, men need estrogen. Yes, men make estrogen, but the main hormone we talk about in men is androgen or testosterone.
Do you like what you've heard so far? If so, Modern Endocrine is now able to provide telehealth services in 8 states, including Arizona, Nevada, Oklahoma, Texas, Ohio, Illinois, Michigan, and Georgia. If you would like to become a patient, visit our website at www.modern-endocrine.com/contact. You can also email us at hello@modern-endocrine.com or call our office at 405-286-1571 to schedule an appointment. Please note, we no longer accept insurance for new patients. However, we do have customizable membership programs available. Your first visit will include a detailed intake, and lab orders will be provided to further assist us in developing your 10 stages to ultimate health plan. We do offer discounted lab rates with a nationwide lab service. And now back to the show. Yeah, so to your point, a couple of things. I like that you made a point about individualized targets. So my patients know that I tell them you're all an N of 1, and so everyone's different. And so I think the hardest thing with hormones, and the reason that hormones get such a bad rap, is because if you do try to stick every human in one box and give them all the same dose of hormones, you are going to not do right by a lot of people. And so what I tell my patients all the time is that if you go somewhere to get hormones and you do not look like or weigh the same amount as somebody else who goes there and you get the same amount of hormone, you need to go to a different location, right? So there shouldn't be like a one size fits all with hormones. And so I think that's the problem, is like there are certain people who do that. And what you have to do, like you said, is you have to give them a dose, an educated dose based on what you know, their labs, their symptoms, but then you have to listen to them. And you also taught me this, like listening to people is important, right? So you have to listen to them when they come back. And if they tell you I have acne or I have hair growth or I have breast tenderness, you have to adjust those doses, right? Those are nuances. They're not necessarily terrible things, because we know, okay, great, you're getting some hormones, you're protecting your bones, you're protecting your brain, you're getting all these benefits of the hormones, but you have to be willing to listen, you have to be willing to adjust, you have to be able to, shift. And that's where, people that are very, everything has to fit in a box, they're not going to do well with
Yeah, a lot,
providing hormone care.
100%. A lot of clinicians have a little bit more narrow focus, and what I would say is, again, if any of your audience is not necessarily physicians, but maybe they are, but any sort of science background, just to keep this as simple as possible. Every human, every one of us, I have more receptors or less receptors in my body than you do. Hormone receptors. Receptors are just these little like spots inside and outside every cell in the body. And as your audience likely knows, there's trillions of cells in the body. I have my own unique amount of receptors. That's the first fact. The second fact is the amount of time it takes for you or my treating prescriber to saturate my receptors with hormones they give me is different from everybody else as well. So because it takes longer or shorter to saturate my receptors with hormones you give me, and I have a different amount, that right there makes everything we're talking about what's called idiosyncratic. It's just very individual. You cannot, and you said it exactly right. This is why some of these docs or some of these providers and clinics get into issues, because they don't know how to talk, like they don't know how to figure out if someone is being oversaturated. They don't know if someone is hitting the sweet spot, and they don't have enough humility to know that the sweet spot's different. So the dose is going to change relative to the human being and how healthy or unhealthy they're getting. And so I think that's what makes obviously you a very solid provider, is you get that principle, but that is a very sometimes difficult concept, I think, for some providers to grasp.
Yeah, and I think the other thing, we were talking about this too, the way my body, how much hormone it's going to take for my body to saturate receptors, and yours is going to be different too, based on a lot of things, based on how inflamed we are, right? And so if you're a very inflamed person, if you're eating very poorly, if you're not sleeping, if you don't exercise, if you have insulin resistance, if your cortisol's high, if you're a type A, all these things that cause you to be inflamed, then it's going to take a lot more hormone to saturate and make your receptors happy, because those hormones have to travel across those receptors into the actual cell membrane to work. And when you're inflamed, that cell membrane is more tense, and it's harder for those hormones to travel, or it's harder for your body to make those hormones or convert them, right? So you talk about this, you taught me a lot about the thyroid. When you have thyroid hormone, first of all, people, I've told you this, you make thyroid hormone and your sex hormones when you sleep. So you have to sleep. You have to sleep consistently. You have to sleep at the same time. You have to let your growth factor work at night. And so you actually have to make those hormones, right? And then once you make them, they have to be converted into active hormones. And so if you're really, really inflamed, right? Your gut's inflamed, you're making poor decisions, you're, stressed out about things that no need to be stressed out about them anyways, you're not taking your supplements, then those things aren't going to work. And so you're going to have to give that person a lot more hormone, right? And then God forbid they actually listen and we start cleaning their gut up, and their thyroid starts working, and they need less hormone. If you don't realize that as a provider and you're giving them the same dose, then they start having bad side effects. You don't realize to pull it back. Then the patient's like, well, I'm not taking these hormones, So
Right.
there's a lot of moving parts. Like you have to be, like you said, a detective, like a forensic detective. I tell my husband all the time, I was like, I feel like a detective all day long. Like I'm trying to figure out what caused what, and kind of just like, I'm a really good listener. That's what I am. I'm really not that smart. I just am really good at listening and like
You're very
moving
smart.
pieces
Yeah.
around,
Yeah.
So to your point, like that, everyone needs to realize that.
Yeah, there's no question. And thyroid, is a passion of mine, obviously a passion of yours, but something that what made me understand thyroid very clearly was when I realized, you know what, the gland is truly a representation of someone's health status, right? I mean, when the thyroid gland goes awry and either is too low, too high, or just quite frankly is autoimmune without high or low, it it just means something else is happening. And so it's when you start to fix whatever that root cause is and address it, whether it's something as simple as just remove wheat from your, ecosystem, or just exercise more, and we talked about this earlier, but do sauna more, whatever it is, um, it just the thyroid gland just functions better. So it's super fun as a prescriber, and this maybe is a little higher level to understand, but it's super fun as a prescriber when I get the phone call that someone's having side effects to their thyroid medicine and I need to reduce the dose. That just means their body's responding and they don't need me to battle them and getting healthy by giving them more thyroid medicine, right? So that's an awesome feeling when that happens, but it requires, a higher level, I think, of someone understanding why. It's because they're getting healthier.
And the same thing with your gut. So you taught me, your thyroid is a representation of your overall health, but so is your gut.
Hmm.
So, if you've got somebody whose gut is a wreck, eventually their thyroid and their hormones and their sleep, it's all going to be a wreck too, right? It all plays together in the same box.
Yeah. Yeah.
So, same thing with sleep. One of the reasons I actually started this podcast, Cory, I've told my listeners this, is because I was so sick of getting on social media and seeing these complete moron idiots that are entrepreneurs saying like, oh, you can sleep when you're dead. You need to sleep 4 hours a day. Like just work, work, work. And I'm like, this is the worst news, like worst education you could give anyone, like
Yeah.
sleep 4 hours a day and just work yourself to death. That's what they teach us in medical school. Doesn't
Yeah.
work very well. So that's really the reason I started this. I was like, people need like good education just in general. Like you should go to the sleep at the same time every night. You should not be on your phone prior. You should drink more water, move your body, things that we're talking about. If a
Right.
doctor's giving you and your husband the same dose of hormones, you need to leave and go somewhere else,
Yeah.
like things like that.
100%.
So okay, so we kind of in general talked about hormones, right? So tell me a lot of, and you have the same questions, I'm sure, but a lot of people will come to me and say, okay, I think I'm having symptoms of menopause, or maybe they won't. Maybe they'll say like, I'm anxious or I was put on an SSRI. What do you think are the top symptoms people have? Like if somebody's listening to this and they have one, two, three, four, who should be considering having
Yeah.
their hormones
Yeah.
checked?
So I'd say interest in a lot of things. So interest in intimacy for one. Interest in intimacy goes down. Interest in just doing anything. So the lack of motivation is a huge driver for a lot of patients I see. They don't have the want to anymore. So if you're someone who's losing interest in most things, things that brought you joy. We used to say if you lose interest in things that brought you joy, that equals depression. Well, if you have symptoms of that, that could be a thyroid thing. So that then parlays over into brain fog and sort of this mental fog or mental acuity is just not as good. So those would be two. Another one, fatigue is kind of that catch-all one, right? So a lot of things cause fatigue. I'm not a huge fan of the fatigue side of it, but fatigue certainly is one of them. I think on the female side, if your temperature or your thermometer feels like it's broke, your thermostat is off, there's something for sure going on with one, two, or three of your hormones. So that I'd say the other part to this is quality sleep. I mean, sleep, and I like that you keep hitting that. Quality of sleep is a big one. Feeling rested, but also being able to fall asleep. If you're not able to do either one of those or both of those, then it could be a hormone sort of side. And then the last piece to this is body composition. If you just cannot build muscle, if you cannot lose stubborn fat despite all the best things you've done, all the ways you're detoxing and all the ways you're eating, absolutely you got to get your hormones evaluated and potentially optimized.
Yeah. And that's kind of how I found BioT, and that's how I found you was I lost interest in medicine. Part of it was because I was living in the traditional crappy world where nobody got better and everyone got more drugs. But I lost interest in that. I wasn't sleeping well, right? I was working out, but I couldn't gain muscle. So, I mean, there was a lot of symptoms that I had, and it was interestingly amazing when you have a little bit of hormone how that gets better, right? Your brain fog gets better, your sleep. Oh my goodness. I tell people this all the time. Like, I guard my sleep like, I mean, it is my sanctuary. So I sleep like a champ. Like,
Good for
I lay
you.
down, I'm asleep in 6 to 8 minutes according to my Aura ring. I get 90 to 120 minutes of REM sleep and deep sleep a night. I usually go to sleep within 30 minutes and wake up within 30 minutes. I get 7.5 to 9 hours of sleep. Amazing. Like,
Love.
but it
Yeah,
took me 37, 38 years to get there, you know?
yeah,
But
yeah.
now it doesn't matter. When we travel, I do the same thing. So like if we travel and we're in California, I go to bed at 7:30 in California because I go to bed at 9:30 here. Like, I'm not letting it mess with my like
Good for
mojo.
you.
Like, I need to like make sure that my circadian rhythm is right.
That's commitment.
So,
Yeah.
yeah, so those are kind of, so men, same thing, right? So men, like if they're fatigued, if they have low sex drive, if they're having issues with muscle mass, if they feel like they're gaining weight, memory issues. I would say depression with women is one thing that I see a lot of. I don't know about you, but I see a lot of women who say, for the last year, I've just been really anxious or really depressed. And so I was given, an SSRI, Zoloft, what do they use? Lexapro, all these things I hate, whatever. And it did nothing really changed. Now I'm just like really flat affected, but I still don't feel any differently. These are all symptoms that maybe things are changing. Your body composition's changing, your mind is changing, your sleep is changing.
Yep.
You need to see somebody about that. Yeah.
100%. Yeah, you got to be evaluated. No question. No question.
And so tell people what is the benefit of taking hormones. So we can start with estrogen and you can just give people like 3, 4 benefits, testosterone in women and then men. So why, if I'm coming to you, Dr. Rice, why do I need to take hormones? Like, doesn't it matter? Does it even matter? Like my doctor said, this is a natural part of aging. Like, why does it matter?
Yeah. So I'm going to start with what you just said. So I hear this all the time too, both from patients, but also colleagues. Isn't it normal for hormones to just go away? Like, why are we changing something that's completely normal? And my response immediately is, well, it's also normal to accumulate diseases as we age. It's also considered normal by the age of whatever it is to have 2+ chronic diseases, whether that's blood sugar dysfunction, obesity, you name it. So if it's normal to accumulate, inflammation and toxins that then matriculate into some diagnosis you get or a combination of diagnoses, that's not the kind of normal I want. And so, losing hormones is absolutely normal. But what's nice is we have ways of fixing that. So the way that I break up your first part of your question is when patients just ask me, what kind of benefits can I see from hormones? So if we just take estrogen, I break it into 2 buckets to keep it simple: medical benefits and then your everyday benefits you see in your life. So on the medical side, I can break it down, by hormone, but on estrogen, it's very clear on males and females. But with men or with females, estrogen is just very protective to, first and foremost, the bone. It's probably the first line agent to avoid any sort of bone degradation or osteoporosis or osteopenia. Very, very, very helpful for that. And as women age, their fracture risk obviously goes up. And as a woman starts to increase that risk, their risk of everything else starts to go up. And so bone health is massive. Estrogen is also quite protective to the coronary vessels. So it's very protective to heart disease, which, as your audience probably understands, the number one killer of everyone still is heart disease. And so we need first line primary preventions, not just, you know, supplements and other things that we can do for secondary prevention. Primary prevention truly is to primarily prevent heart disease. Hormones do that, particularly estrogen. The third side of that medical protective coin is cognition. So we need estrogen for cognitive help and to avoid any sort of cognitive decline. So now in the male side, if a man doesn't have estrogen, he also can get osteoporosis. So we see osteoporosis and bone loss in men, which a lot of people don't realize that, but it absolutely happens. And so that's number one. Number two is without estrogen, men don't have good erectile function and they don't have, they can't lose fat. So men need a little bit of estrogen to be able to lose fat. And so that's on the medical protective side. I think on the subjective side, on the female side, estrogen, as you know, is a head to toe lubricator. So if you've got mucosa, wherever the mucosa is, so one big thing that is overlooked oftentimes is women who get eyes that are dry. So they're just complaining of like using eye drops and things like that. Well, estrogen done the right way can help lubricate that mucosa. It's also something that helps joints, right? So joints can dry up, skin dries up. Certainly, vaginally, women can get dry, but it's not just vaginal dryness, it's truly body dryness. So it just lubricates done the right way. And it also helps those stubborn hot flashes that women just, some women don't go through that the ones that do absolutely hate it. And so that sort of dovetails into the sleep side of it too. So again, it's those quality of life sort of things along with medical protection. And then on androgen slash testosterone, it's kind of back to that. The medical protective side is to remove fat efficiently, help build lean, dense mass if you are putting in the effort to do that on the resistance training side. Testosterone has some impacts as well on lipids, a little bit of blood sugar. Really, testosterone is a independent predictor of vascular health as well. So if your testosterone level is low, then you are at risk for coronary blockages or vascular sort of plaque deposition. So medically, that's something in men and women that it helps with. But then subjectively, absolutely orgasmic function, desire for intimacy, sleep, as we've mentioned, energy, those night sweats that women hate, it certainly helps with that as well. So that's sort of how I break it up. Medical reasons, subjective reasons, and usually when I go through that, most people are very much on board with doing what's necessary to avoid, but also help some of those things.
Yeah, and I would say to your point, like people come to you, men and women. I've had people come to me and say, I want to take hormones just for low libido or, just for bones. But I have seen some dramatic improvement in dry eyes and urinary tract infections, like, change people's lives. Because if you're a woman in your 60s or 50s and you have a urinary tract infection every month and you can't have sex with your significant other and it hurts when you walk, I mean, that affects your life. Not to mention it affects your gut because every time you're on antibiotics, you're messing with your gut, right? And so I have
Yep.
had, joint pain, but then also cognition. Like you said, some people don't realize how important testosterone and estrogen is to blood flow, for blood flow to your brain. And so, I mean, I have had people who are like, oh my gosh, my memory is so much better. So there are so many. And then to your point, body composition, like everyone in the world wants to lose weight. Every woman in the world will tell you they want to lose weight. And so just that body composition, not only of just like the amount of weight on the scale, because you and I talk about this a lot, but your muscle mass and the actual composition of your
Hmm.
body changes a
Hmm.
lot, right? And,
Yep.
I did a post on social media in March, I think, about this that got a lot of it went around for a minute, but I put a picture of me kind of before I started BioT and before I did any sort of hormones, and I weighed 118 pounds, but I didn't have very much muscle. And then I put a picture of me in March of this year with a bunch of muscle, and I weigh 130 pounds now. I'm getting up there, but I look totally different. Like, I'm not kidding
Yeah.
you. I was like, okay, this is me at 118, this is me at 130. Who looks better? And people were like, no. And I was like, yeah, yeah, that's 130 pounds of muscle and that's 118 pounds of fluff.
And
Like, so,
I bet you feel demonstrably better now than you did at
oh, I
118.
feel so good. But I'll be honest with you, and I tell people this, I'm very honest. As a woman, that's hard because I had a point in my life where I was heavier and then I got a lot thinner and I was like 110 to 120, like my whole, in my 30s, like 120 was the scary number. Like it was like that. Yeah. No. And
Yeah.
so when
Yeah.
I started doing hormones, I got to that 120 pretty quick. I think I told you this after my first pellet, I gained like 7 pounds and I was like, what the heck? A lot of it was
Yeah.
water. Some of it came off, but then I kind of yo-yoed between 120 and 125. And even though I felt better and I looked better in your brain as a woman, you're like that. And then I got to 130 and I was like, dear God, but my pants fit different and I have more muscle. And then it really like, I was having a moment in March where I really like I got to 130 and I was like, this is like I just was beating myself up. And I was like, I'm gonna look at a picture. And when I put those pictures together, I was like, and that's why I posted on social media because I was like, okay, yeah, I'm taking the 130 over the 118 like
Yeah.
all day long.
Yeah.
So it is important that people understand that. Like it's for body composition, it's, so it makes you feel good, but it's also good for your body.
Yeah, how you distribute the weight is
Mm-hmm.
massive relative to what I call the cry box, right? That little
Yep.
square on the ground you step on, it's just there to make you cry and to defeat you. But how do your clothes fit, right? Do things around your waist fit more loose? And the other reality, like you mentioned, is firmness, right? Yes, every woman wants to lose weight. They also want to be firm. They don't want to be fluffy. They don't want to have that doughy sort of feel. And done the right way, hormones help distribute the weight in a healthy way where clothes can fit more loose. Forget what the cry box says, but clothes can fit more loose, you feel better, and the more muscle you build, the better metabolism you have, and it's this whole vicious sort of cycle where you sort of insulate yourself into this amazing um, metabolism because now you have more muscle. Forget what the cry box says. It doesn't matter. I mean, you feel great, and it's really hard to retain muscle as you age. I mean, you know that. So that's one of the big benefits of the therapy.
Yeah, that was where I was going with that too. I've never actually been happier. Like I kind of joke with my husband every now and then, like maybe I should go on a diet and lean out. But honestly, I eat so much food now. I've never eaten this much food in my life. And it's great. Like I pretty much eat whatever I want. Like I don't eat bad, but I don't really like, I eat a lot of food, lots of food.
Hmm.
And I have the ability to do that because I have a pretty good metabolism. And I mean, I lift weights, but it's really nice because I spent a lot of my 20s and 30s, like most women, like restricting yourself and like, oh, I would love to eat that, but I don't. And it kind of makes you cranky. And
Yeah.
now if I want, what I mean, somebody brought protein balls today and like these little gluten-free, dairy-free little cookie things. I'll just eat whatever I want. I don't
Yeah.
care.
Yeah. It does. Yeah.
So
You
it's
don't
kind
feel
of
bad.
nice, right? But I
Yeah.
was also at the gym this morning at 5 o'clock working out with my team, so I worked out for an hour and I built some muscle. So I
There
mean,
you go.
it's nice.
Perfect. Yeah.
Okay. So those are kind of the symptoms. And so now people that are listening are like, okay, now I'm intrigued. But they're thinking, okay, well, Dr. Rice, doesn't hormones cause cancer? Like, if I do hormones, isn't it going to cause breast cancer? Is it going to cause me to have heart disease? Is it going to cause me to have prostate cancer? So I have told them no, but what is your, like, you tell them as the
Sure.
hormone expert, what, like, does
Yeah.
hormones cause cancer?
Yeah. So let's keep this logical. Let's talk about ladies first, because ladies always want to know about the breast cancer risk. So, first and foremost, definitively, it has been proven estrogen itself does absolutely not cause breast cancer. There's some wonderful resources out there that have shown this and proven this. And then the other thing to think about very logically as a female, the highest estrogen levels in a woman are when she's pregnant. And if estrogen caused breast cancer, pregnant women and honestly children within that woman would get breast cancer because estrogen is so high when she's pregnant. And so we don't see that. Women typically are getting breast cancer in later years when they're a little more estrogen naive. So to say it's causing it is just a little bit backwards. Now, I think where the misconception gets is women know women that have had breast cancer that has been hormone receptor positive or estrogen receptor positive, which means on that tumor, it has estrogen receptors there inside the tumor. They then extrapolate that and say, oh, well, estrogen must cause this. Well, 80% of all breast cancer is estrogen receptor positive. And what I would tell you as a woman is that over time, if you have had breast cancer, first and foremost, testosterone, by and large, in the majority of cases, is perfectly fine. It certainly doesn't lead to any sort of breast cancer risk. But I've had a number of women over the years that have had breast cancer definitively treated, no more problems left, that have elected to be on some form of estrogen because they want bone help. They want the lubrication we've been talking about. They want the cognitive help. Now, among the oncologists that I know, there's a couple actually in Dallas that are completely fine with this, but among the oncologists I know, that is not the standard of care, is to give estrogen to a woman who's had estrogen receptor cancer, at least of the breast. I just think at some point we are potentially going to be in a spot where estrogen is not so demonized. I think now the literature has been clear on that. So, um, that isn't a concern. Testosterone, again, there's really, and actually the opposite of that, used in gargantuan dosages, testosterone to women has actually been shown to be breast protective. And so I don't think there's any concerns there. I think any breast cancer survivor should strongly consider being on testosterone because it at least can have some benefits to the bone, to the temperature, and libido, and all sort of the other things we talked about. Whether the estrogen's an option or not is really going to be up to their treating provider and really the oncologist. But estrogen really is just not this boogeyman in the closet that we've made it out to be. Now, on the male side, you mentioned prostate cancer, and that's also one thing that's been definitively proven as well. Low testosterone is typically where aggressive prostate cancer occurs. Men that have optimized testosterone, somewhere in that upper 25th percentile of whatever the reference is on the total side and the free side, have a much less risk of getting prostate cancer. So prostate cancer, just for the record, occurs when men have low testosterone. We can define that as less than 400, less than 300, less than 500, whatever that cutoff is for you. The American Urologic Academy says less than 300. So anything less than 300 is low T for them, but that's where prostate cancer typically lives.
And then what about, well, and quickly, I do not consider a testosterone of 400 normal, just for the listeners. And I don't think you do either, Dr. Rice, depending on your age. But
Yeah.
yes, reference ranges will tell you that if your testosterone is 300, you are normal. And I would tell you that I would love to find a man whose testosterone is 320 who is less than, 90 years old that feels well with that level. So, right. That's not normal. That might be reference range normal. That is not optimal. And you probably don't feel well. And the people around you probably don't like you. What about, so I agree. So testosterone does not increase your risk of prostate cancer. Testosterone's actually been shown to be beneficial to women when it comes to breast cancer. Estrogen does not increase your risk of breast cancer. I agree with all those things. What about heart disease? I've had a cardiologist lose their mind on me before because I was trying to kill someone with, testosterone. So
Yeah.
tell me.
So, and I'll speak to men specifically. Women have a very narrow therapeutic window on testosterone in which it's that sweet spot discussion, like too much, Goldilocks, that whole thing. On the male side, that's really where this comes down to as far as heart disease risk or increasing it. All this came from, there's four poorly done studies, terribly done studies. The validity, credibility, legitimacy of which has been questioned by all sorts of experts, and the FDA included. And the FDA mandated, they put this black box warning on testosterone and basically mandated that better studies come out. And so your audience may be familiar with last year, Traverse came out. Traverse, if not, look it up, and it's in the New England Journal of Medicine. It basically took the highest risk men, so men that have known heart disease or have many risk factors for heart disease, and put them on testosterone and basically tracked them to see if they developed any increased risk of heart disease or had any heart attacks. And what they found is with testosterone replacement, there was no increased risk in this. And this is in the highest risk men. Now, a plausibility argument is to say, well, can we extrapolate that to healthy men? They didn't study healthy men. They studied the most unhealthy men. So that's something that you have to understand. But testosterone, as I mentioned earlier, we know this. So inflammation is the root of all heart disease. Inflammation, to break that down, is really just a bunch of what's called chemokines and cytokines. It's all these inflammatory particles that sort of build up inside the artery and then ultimately lead to plaque deposition in there. We know that low testosterone causes huge increases in all those inflammatory particles. Optimized testosterone does not. It lowers all of that. So it sort of acts as a protector for that arterial wall to build plaque. Now, that has been delineated in reproducible study after study after study. So that's where I think a lot of this came from, is this mass media sort of thing about these studies, four of which that were just really poorly done and poorly designed. The one that got the most publicity was in 2013 in JAMA, And it was a male study, a complete male study, and 10% of the patients were women. So it's just crazy. And when you reanalyze their data, it actually found that patients who had received testosterone had double less risk of getting heart disease than patients who were on or treated with testosterone. So all I can tell you is what happened is a media, outlet got a hold of this article, ran with it, assumed it was true, and then it just sort of took off. And before you knew it, attorneys were, putting out commercials about testosterone and your risk of this, that, and the other. But there have been double the amount of studies done since those time periods of those 4 studies that have shown testosterone does not increase cardiovascular risk, with the most landmark one being last year in Traverse, because that was a randomized controlled trial that was non-inferiority. It was the highest level of medical evidence you can have that showed that in high-risk men. So that just needs to be put to bed, honestly.
Yeah, so what I'm hearing you say is that if you have a patient and you're providing individualized care and you're following symptoms and you're giving them hormones that are, and we'll talk about this, bioidentical in doses that are protecting them and providing benefits, but not in doses that are, far in excess and causing symptoms, then we should be good.
We should be good. Yep. Too much
Okay.
of a good thing is not a good thing. Exactly right. So it's got to be that sweet spot.
Yes, and I would completely agree. And I would say if you are listening and you've heard otherwise, there are lots of studies and you need to maybe find a provider who can help you walk through this because a lot of providers, were trained 10, 15, 20 years ago and they've never looked at the literature or the only thing they've heard are the bad things. The people that go to maybe a clinic where they just give everyone a massive amount of a hormone and then, the other thing is maybe that person does have a bad side effect, but do we always know that there is a causation like that's actually really what caused the problem that person had, maybe that person was already inflamed or so again, I would just say that I agree with you completely and that hormones done, I feel like in the best route, the best dose, the best frequency without, bad side effects are very beneficial.
100%. Yep. For sure.
So then let's talk about how you do hormones because I know you get this a lot as well. So I have people come to me and they say, okay, we get through all this conversation. Okay, I want to do hormones. Start with women. I want to do testosterone shots. What would you say to a woman that says, I want to do testosterone shots? Is there a better way to do it? Should I do this? What is
Yeah.
the difference between doing a shot and a cream, etc.?
Yeah. So I'm very much meet patients, females and men, where they are. So I don't want to exclude anyone. I want to include everyone. So if I believe in hormones that much that I don't want to say you have to do this or you have to do this. This is absolutely a partnership. So I've certainly got some women that I give them their options, right? So when it comes to testosterone, you've got creams that you can apply. You've got injections you can apply. You've got troches, which are sort of this under the tongue, sort of sublingual testosterone if you want to give that a shot. And there's a therapy called pellets. Pellets are considered long acting. So they're implanted under the skin. They last for a few months and there you go. Shots, creams, troches, the advantage there is that the patient controls what's going in their body. The physician controls the dose. The patient controls whether they take it or they don't. Initially, that's a convenience because they are rubbing, they are injecting, they are taking orally. However, what I've noticed is over time that becomes a little bit of a inconvenience because continually having to rub something on your body and hope it doesn't get on your shirt or on other people or pets and things like that can be annoying. On the injections, some people do well on those and like those. A lot of people, after a few weeks of trying that, get a little bit tired of constant needles. And honestly, you would know this, but if you do injections appropriately, you really should probably be doing them twice a week to avoid the roller coaster of absorption that you see with shots. Things given in shot form, as you know, you inject it, it goes up, it goes down. There's no, it's just time released. It goes up, it goes down, it goes up, it goes down. And so that's an emotional roller coaster for people trying to get their hormones right. So that's one thing. I also find that with injections, you have to monitor blood work a little bit more because there's just things that happen that don't happen with other forms of therapy. And then on the sublingual approach, it's the same idea as the absorption varies considerably among, 2 different humans, and it's hard to really dial them in appropriately. It's hard to find a sweet spot with a trochee because it's just so volatile. It's a rapid rise and then fall, and then rapid rise and then fall. And so a lot of times patients will graduate over into a long-acting therapy like a pellet. Pellets have been around since the 1940s, 30s. So they've been around a long time, but some people want to start out the gate with that therapy, which I assume your audience understands is just a small incision under the skin. The little hormone pellet is put inside the sub-Q space, the little soft spot under the skin, and they last there. In a female from 3 to 4 months, depending on the woman, and then the male, 4 to 5 months, 6 months, whatever his absorption pattern is. So I mean, it's the same on the male side. You have short acting, and you have long acting, and so I will offer all of them and give them the advantages and disadvantages, and let the patient make the decision, and then I document in the chart the discussion we've had. That's basically how I do it every time.
So, what is the advantage or disadvantage to oral estrogen? Let's talk about that because I'm not a huge fan of oral
Yeah,
estrogen.
yeah. And
Um,
actually, I don't prescribe oral estrogen because I get a little nervous about blood clots and what it does through the liver as it relates to the clotting factors through the liver. So I'm not a huge fan of oral estrogen. I know that you can make it, bioidentical or natural, and that's okay. But that whole first pass effect, I just don't know that they're getting all of the compound that I want them to get. And when I have other things that bypass the liver to increase those clotting factors, I just sort of stay away from that. So on estrogen, you've got oral, you've got creams as well, you've got patches, and pellets. And so it's kind of back to the same discussion. If you want to change a patch every 72 hours, totally fine. If you want to rub a cream on the inner thighs or wherever you want to put it, that's totally fine. But remember the two things we talked about earlier. Are you getting the medical protection? Are you getting the symptom alleviation? The medical protection takes a while, right? It's hard to objectify medical protection outside of what we know. So to do a bone density scan and see a score, you really have to wait quite a while on something to see that it's getting better. It's not going to happen overnight. The symptoms, you would hope, at least in most forms of hormones, done right, happen, you can alleviate those symptoms pretty quickly, within a few weeks or potentially a few days in some of these patients. So if you're not feeling it, then we either need to we check blood work, assess the symptoms, and then you have to either increase the dose or potentially change the way you're giving the compound. So, uh, each one has its advantages and its limitations. There's no real perfect way. The perfect way is what gets the patients the two things they want: medical protection, symptom alleviation, and you just have to, and what keeps them on the therapy to have. Because the question comes up all the time. I'm sure you get it. Well, how long do I need to be on these things? Well, as long as you want the benefits. And so that's really what it comes down to.
Yeah, I would say I'm not a huge fan of oral estrogen either because of the liver for the first reason. Our liver is so inundated with toxins, you guys, from what you put on your skin to what you eat, what you breathe, what you like we don't need anything else going through our liver to be processed that doesn't need to be there. So that's what I tell patients is like I'm with you. It increases your risk of clotting. It just puts more work on your liver. It also increases your sex hormone binding globulin, which then lowers your testosterone. So anything that messes with your sex hormone binding globulin, I'm not a fan of. Your weight also does this. So this is the number one reason you have a high sex hormone binding globulin, especially in men, is when you're obese. And that is why it's harder for obese men to have proper levels of testosterone because that sex hormone binding globulin binds up all their testosterone and then they don't have any free available at the receptor to go across the receptor. And then, oh, by the way, when you have obesity, you're inflamed anyways. And so lots of issues there. But I am not a huge fan of oral estrogen either. I don't typically give it. I would also agree that the injections are hard, especially in women. Like, I'll meet you where you are. I agree with you. It's not a dictatorship in my office. We're going to meet you where you are and do what you want. But I will tell women a lot of times when you're doing shots, it's very difficult to get the dose right because you're going to have these peaks and these valleys. And it's also very difficult to draw the right amount of testosterone when you are a woman because it is a small amount, very, very small. And so I also tell them, if you give yourself too much and you lose your hair or you get acne, I'm going to write in the note that I told you that this
Yeah.
is going to happen. So you can't cry or be mad at me. And, I tell my patients this too. I never ask patients to do things or give them treatments unless I would do it myself or I have done it myself. And so I try to do everything that I mean, obviously I'm not going to give myself run my testosterone to 1200 like a man,
Right.
but
Right.
I've done testosterone every way you can do testosterone. And I myself, as an educated physician, couldn't give myself the right dose of testosterone in an injection. So, and I lost some of my hair. So it's just, I mean, it's hard because like it's a little amount. So I agree with you. I think if you are going to do injections, you've got to do them frequently in very low amounts, so you get more of like this rolly instead of this. And so it's a convenience issue after a while. And you're right, like the creams, in Oklahoma and in Texas, it's hot right now. And so if you're putting cream on and then you're sweating, is it really absorbing? Is it not? You have to find the right base consistency. And so that's where you and I mean, I do think that pellets are a very good option for a lot of people. Now, people that are control freaks, yes, once it's there, you can't take it back. But then I think that, you and I, we've done thousands of pellets. You've probably done tens of thousands. And so you kind of just get comfortable with that, like knowing what a person needs, making sure you under instead of overdose, and then letting them feel the benefits. And so I agree with you. Like if you are listening to this and you're thinking, man, maybe I do want to try hormones, but that sounds scary, then at least give the creams a shot or give something a shot. Start noticing the benefits that you get. Notice that your eyes aren't so dry. Notice that you're not so tired. Like start feeling some of those things. And then as you stop feeling those things because you aren't consistently doing your hormones, then you can start thinking about other routes. Or you could just go for it like I did. I mean, I came to see you at BioT in 2020. I was like, yeah, this is awesome. And I just did a pellet. Like, let's go.
Yeah,
you know?
there's no harm in getting tested. There's no harm in getting your
No.
blood work done and just having a conversation with an educated person. Operative word being educated.
Yeah, for sure. Educated, and also I would say somebody who is willing to meet you where you are, but also understands like individualized medicine. I think
Yeah.
that's really important. I unfortunately think that more and more people are going to need hormones as time goes on because our environment is so bad. We have so many toxins. We're so inflamed. Our food is sick. We're not taking enough micronutrients. We're not sleeping enough. I mean, I honestly, it's sad. I hope not. Like that's why I do things like this. I want people to get educated. I want them to get well. I want us to be a country of wellness instead of illness. But
Right.
unfortunately, that's not typically what happens in the United States. And so I think ultimately long term, more and more people are going to need hormones, right? We're living longer, we're sicker, we're losing hormones faster. And so that's why we need education like this. And we need providers that can actually look at people and deduce, what's going on and actually, like you said, be little forensic investigators and figure out how to help people. Because when we put everyone in the same box, that's where we're going to have problems, unfortunately.
100%. 100%. Yep.
Yeah. Okay. So I think I hit on everything I wanted to. I wanted to talk about, why hormones are important, what they do for you. Do they really cause cancer? Some different treatment options. Is there anything else you think that listeners would get out of this as far as hormone health?
No, just don't be afraid of them. And I understand that you have people friends, sisters, mothers, if you're a female on the male side, brother, father that have had potentially breast cancer or prostate cancer. Um, and I know that that's a hard pill to swallow to consider going on a hormone that you felt like contributed to that. Um, just understand in the majority of those cases, if not all of them, the hormones really had nothing to do with why they got cancer. That can be for another podcast. There's a whole host of reasons why people develop cancers. And I would say hormones are not they're not the enemy here. They're actually part of the solution in a myriad of respects on the health protective side, as I've said, but also the quality of life. I think quality of life, unfortunately, is overlooked a lot of times in healthcare. We focus on labs, we focus on scans, we focus on papers and forms and questionnaires. But a person's quality of life is it might be the most important thing, honestly, because without that, I think the other things I just said creep in, and there's a bigger risk there. So No, I would just say that I think the emphasis needs to be 100% on the benefits, and the risks need to be, again, with an educated provider who is willing to understand that everything is individual. Um, it's just a win-win. I mean, it's just a win-win. I can't tell you. I just I don't see negatives in my with my own eyes with the people I treat in this particular context of what you're asking about. And I think it's because people like you and me surround people with all sorts of ways to optimize their health that don't just look at one thing. And so hormones are absolutely a part of the solution. They are not part of the problem.
Yeah, to your point, I mean, like you said, the root of all illness and evil is inflammation. And so whether people want to believe it or not, if people get cancer, then we need to look at them in general as a whole. What are you eating? Some of it's gene driven, but like what are you eating? What are you doing that's causing inflammation? What are you doing that's helping your body detox? And so in general, I would say that yes, cancer is inflammation and a lot of it is weight based. We know that a lot of your risk factor for cancer is age and weight, right? And then
Yep.
inflammation. So it does bother me when people say, well, hormones are the culprit. Well, when a lot of times it can actually be the solution.
100%.
So I just think that people need some different education, some different education, standpoints, some different people talking about it, and then do your own research or see a provider and try it for yourself is what I would say. Because I'm in the same boat you are. Like I'm not going to force anything on you, but I have helped thousands of people now feel better. And it's a really good feeling because when I was in the traditional world, it wasn't like that. I gave more and
It's a
more
great.
people pills. They got sicker
Yeah.
and sicker. And now my goal every single day is to take more and more medicine away from you and make you better. So you never have to come see me again, you know?
Oh, Cassie, I'm just so proud of you. You have
Oh,
that is just you've done so well. So people are so fortunate to have you.
well,
You need to
thank you.
clone yourself. So
You too. Okay, so I
okay.
have three questions. They're quick that I end every podcast with. So just
Nope.
don't overthink it. This is just so that people have some just some basic knowledge. So, what is one food that's the most beneficial and why?
So in my opinion, the master food is the food that people don't like a lot is broccoli.
Okay.
Uh, Try to eat it as much as possible. Don't steam it. So you can lightly steam it. Don't overcook it. Um, do not get, you want to clean it as much as possible too, but broccoli is the master detoxifier, period. You do enough broccoli and you will, it's nutritionally, it's basically nutritional sauna. You are ridding the body of toxins. You are inducing all sorts of amazing science and chemistry with throughout the liver to induce the metabolism and excretion of just things that honestly, eventually, if you don't do that kind of stuff, can damage DNA, which then can ultimately lead to some of the worst outcomes that you can imagine.
So we can dip it in hummus, just can't cook it. Can we blend it and put it in a smoothie?
I've never done it, but that is probably okay. You just don't want to overheat it.
Okay.
Is the key. It denatures
Okay.
it to the point you lose a lot of the properties.
Okay. Because raw broccoli, I'm not gonna lie, I'm probably not gonna do, but I'll dip that stuff in hummus for sure. And then I'll
Yeah,
just
there
put
you
anything in a smoothie. So,
go.
okay,
Good.
so you
There,
have it, broccoli. I don't think we've gotten broccoli, so that's a good one. What is
yeah.
one thing that anyone can do for their health that is free to
Oh,
make their
most
health better?
important. Yeah, the most important prescription for one's health. It is the perfect drug that only brings benefit and produces zero long-term harm, and that is zone 2 exercise. Done. It is the most any human being can do it. It doesn't require a membership anywhere. It doesn't require you to pay a nickel for anything. It's the way to maximize fat loss. Fat on the body, adipose on the body, is where disease occurs. You know this as an endocrinologist. So if you can do zone 2 training, very simply put, 30 minutes a day or 30 minutes 5 days a week, keeping your heart rate 60 to 70% of your max heart rate, let's just say roughly between 100 and 115, 100 and 120, you can do that literally walking up and down your driveway for
Mm-hmm.
30 seconds. That will lower your risk. That right there will lower your risk of every disease you can name. All cancers, Alzheimer's, Parkinson's, dementia, all of it. Diabetes, heart disease, it will lower that risk, period.
Yeah, and you can do it for free. So if it's too hot outside, then walk in your house. And people who say, well, I don't have anywhere to walk in my house, walk in place. You can jog in place. You can walk around your island, but it is free. And so, and
Yep.
for my team who hates me because we go to the gym in the morning and I make you do cardio for 20 minutes at the end of our lifting, you heard it from Dr. Rice. We all get on the treadmill, we walk on an incline, and the rule is you walk on an incline until while you can have a conversation. If you're walking and you can't keep having a conversation with me, then it's probably too much. Then we either go down on the incline or we go down on the speed. But you should be able to do that and have a conversation. You're probably in zone 2, and we do it. We do it for 20 minutes, but we do it every day. So I love
There
that.
you go. I love it.
Okay. And if you do it with others, it's easier, I promise, because I hate cardio
Oh,
too.
yeah. Oh, yeah.
And then the last question I have for you is what is one thing that you wish you could have changed about your health 15 years ago if you would have known? Like what's something you wish you would have known 15 years ago that you would have done differently so that your health would be better today?
So 15 years ago is when I figured out I had the ApoE gene, which is called the Alzheimer's gene. I also figured out I was MTHFR positive, which basically means I don't detox. So that's when I changed everything in my life. So in that time frame, had I known in 15 years ago how important regular sauna use was, I would have implemented it immediately. When I put sauna in my life 2.5, 3 years ago, it changed everything. And I was already exercising, eating well, supplementing, hormones, all the stuff. But sauna is a literal game changer. And I'm almost close to telling people that I don't know how someone can survive in 2024 without regular sauna. It's like breathing, brushing your teeth, drinking, going to the bathroom. You have to have sauna. So, and I'll just leave this audience with one little factoid. In Finland, every home is built with a sauna. So in America, if a standard home is a 4-3, 4 bedrooms, 3 baths with a kitchen and a bathroom, or 3 baths, in Finland, you have the same thing, but you put a sauna in every home. So their culture, kids, elderly, everyone in between, does sauna. And if you look at their diseases and all the things that they deal with, it is much lower than anywhere else. I truly feel that if I could have done that 15 years ago, I'd love to know how I was today, how I felt. That would be my answer.
So we're talking about like a steam sauna, a dry
Yeah.
sauna, a
This is
red light
important.
sauna.
Thank you for asking. So, very importantly, I'm talking about dry sauna, hot sauna. I love infrared and I love red light, but sauna, if you're talking about how to lower the risk of like up to 58% of all causes of death, including Alzheimer's dementia, there's a minimum effective dose on what you have to do for dry sauna. And that's on the order of about 174 degrees Fahrenheit for around 19 minutes for 4 to 7 days a week. That is what gives you about a 56 to 58% reduction in heart attacks, strokes, dementia, cancer, all of it.
So
11 minutes,
100, say
11
that
minutes,
again.
yeah, 11 minutes gives you 8% reduction. So the sweet spot is somewhere in that 19-minute range.
So if you do 174 degrees Fahrenheit for 19
Minimum,
minutes,
minimum. You can go higher, but minimum is 174. So around 80 Celsius,
uh-huh.
you do it for 19 minutes is the sweet spot. You do that, that gives you about a 56, and that's 4 to 7 times a week, a 56 to 58% reduction in all causes of death.
Okay.
There's nothing
So
else you can do besides exercise that has that kind of reduction.
yes, and my listeners know because they know what my morning routine is. They've asked. So you guys, you know how I told you that I put a sauna in my house a couple of years ago? It was because of Dr. Rice. So he told me he got this sauna in his garage. I got the exact same one. And I actually made a room in my spare bedroom upstairs that my sauna is in. And so I incorporate this, I would say 4 to 5 days a week, not every day, but I do it. And I put it on social media. I go to 90 degrees Celsius,
Yeah.
90 degrees Celsius.
You and me both.
I can only stand there about
I'm actually a little
15.
higher than that.
I can only stand there about 15 minutes. It literally starts to burn my skin.
Yeah, I'm pretty heat adapted. So I'm about a 15-minute guy. I do 11 minutes after a strenuous workout. I can't stand there longer than that.
Yeah. So after I work out, I do 90 degrees Celsius. I do 15 minutes. But here's where I got you, Cory. I do a standing core routine for 10 of it. And then I meditate the last 5. So I do my core in the sauna. So that way I get my good core in. Like I can send it to you. It takes 10 minutes. It's a really good core. You get upper, lower sides. And then I set and meditate for the last 5. But it's because of you that I have my sauna. So see, everyone can thank Dr. Rice for my morning routine, but I have one and I would completely agree. I love it. It's life-changing. You sweat. It's kind of
it's next level. I want to challenge you one day we need to try to do a podcast from the sauna.
Okay.
That would be
I don't know how we would do it, but
I think cognitively, I want to know if I could even keep at that 12 to 15 minute mark. I think we would be like, I don't know that we could do it.
We're also going to have to figure out camera angles because I think we sauna the same way, which is without clothes on. Because
so that's the whole other thing. So yeah.
Like you can't wear anything because everything hurts. It's so hot. Like
yeah, so maybe that's not a great idea. But anyway,
we can try to figure it out. We'll get back to you on that one. But no, but I want you to do this. Like we'll figure it out. But then I will challenge you to do a standing core routine in there, even after you work out. Like I'm
gonna try to figure that out. I'm gonna try to figure out how to do that.
Yeah, I'll send it to you.
I like it.
Okay. Well, thank you so much for joining me on this episode. I'm sure that listeners are going to love it. One of my episodes that they resonated the most was a hormone episode. And I know that you've been so beneficial in my life. I know that you touch so many other people's lives. So Dallas is so, privileged to have you as a provider. We're going to link all of Dr. Rice's stuff in the show notes. So if you are in the Dallas area and you want to see him, then we will make sure that we get all that information. I send him patients all the time that reach out to me. And just thank you for fighting the good fight and everything that you do.
Thank you for being such an inspiration. So really, I truly mean that. So keep doing a great job with my patients. I'll keep sending them to you and have me back on this thing. I love talking. So
I will. And if you guys enjoyed this, please make sure you share it. Like Dr. Rice said, we know that you know someone that could benefit from this. Anyone that has the symptoms we talked about, make sure that you share it with them. Like and subscribe, follow so that you get all of our podcasts. We drop on Sunday now. And then also make sure that you leave us a review, please. Have a good day.
Awesome. See y'all.
The information presented, including any materials discussed, referenced, or linked within this podcast are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.